The government has changed its strategy on vaccinations for long-term care residents, partly due to the Pfizer vaccine being limited now. It's going to speed up its goal to have everyone vaccinated by February 5th. That's every long-term care resident. It's 10 days sooner than planned. It means doses for frontline healthcare workers, though, and essential caregivers will be paused for now. But experts are wondering why that wasn't done in the first place, especially after reports hospital administrators were jumping the line.
I think Ontario is performing the worst across the country when it comes to long-term care homes during the second wave.
Since the first vaccine was administered 6 weeks ago, close to 1,000 long-term care residents have died of COVID-19. The government now says it's hastening the pace of vaccinations after a report last week concluded getting them done 2 weeks sooner would prevent 600 infections and 115 deaths. Today, the Premier defended his government despite being behind other provinces. Alberta and Quebec finished vaccinating all elderly long-term care residents days ago. Ontario is at less than 80%.
Early on, we had Pfizer, which meant we could not get to the residents of those long-term care homes.
But Pfizer eased its strict transportation guidelines on December 18th, while Quebec, for example, moved quickly to bring the vaccines into long-term care homes. Ontario waited 3 weeks to do so, while Wave 2 continued to spread.
The results speak for themselves.
The Premier was also asked again today why the Army hasn't been brought in to assist long-term care homes in crisis.
I was told, I should say, that we don't need them.
And yet horror stories have been emerging regarding lack of care, most recently at Roberta Place in Barrie, and last month at Sunnycrest in Whitby, where all but one resident tested positive and 34 have died. A long-term care inspector found less than 50% of staff were working because many had fallen ill, and vulnerable residents were not being cared for properly. It took another week before the Red Cross moved in to help.
The smell of urine was sickening. The poor woman in the bed beside my mum was so sick too. I looked the bathroom that adjoins to the other one. The woman was half falling out of bed. There was feces all over the floor.
The Long-Term Care Commission talked to family members, including Bev Kelly, last week. In a transcript, Kelly, who found her mother in appalling conditions just before she died, stated, "I'm horrified to think she was in bed with no liquid, that nobody fed her, that nobody changed her. I don't think I will ever recover." Another grieving family member said, "If I had an animal that was treated like that, I would be charged with animal cruelty."
We need to have a system where resources and supports can be rapidly, not within weeks, not even within days, but within hours, mobilized to homes to save lives.
Now, toward the end of the news conference, Doug Ford was pushing for greater border control, which has been proven to be popular when he's done so in the past. He's calling on the Prime Minister to close the Canadian border to all non-Canadian citizens or residents and wants anyone who does get into Canada to be tested.